What's your opinion on metformin for treating IR? I recommend it. I use it personally. There's a study called TAME, Targeting Aging with Metformin. And it was developed, gosh, I'm blanking on his name. I had it right at the tip of my tongue. He's at Albert Einstein in New York. He's the principal investigator for the study. But the study was really developed by the gerontologists at the National Institute of Aging. And basically what they were saying is, we know that the majority of what we call normal aging is really associated with insulin resistance, which happens as we age. What if we just put metformin in the water? And that's essentially the study hypothesis for the TAME study. Once you get age 65, half of folks get a placebo, the other half get metformin. Other folks like David Sinclair, a world-renowned anti-aging researcher at Harvard, as early as early 50s, just as a preventative for aging. It has several different impacts, which may be beyond the scope of the discussion for today. People ask me, well, how does metformin work? Well, the standard answer is it decreases the liver's ability for what we call a glycogenesis. Glyco meaning sugar, genesis meaning making new. The liver stores a glycogen, which is basically just chains of one sugar molecule after another after another. When our brain tells us to hit cortisol in the morning for dawn effect or epinephrine for the fight and flight, they stimulate that liver to release the molecules of glucose off of that glycogen and raise our blood sugar. I personally think there's more than that going on. For example, about 20% of us will have GI symptoms, gas, some even nausea, some diarrhea for a week or two when we start metformin. If you look at somebody's gut that has insulin resistance, it's got a different biome from someone who doesn't. And sure enough, if you look at someone who's been on metformin, it tends to drive it more towards the non-insulin resistant type biome. So I said maybe it wasn't the scope of this project, but I went ahead and talked about that anyway. We don't fully understand all the mechanisms for metformin, but those are just a couple of them. So I'd like to talk with you a minute about the webinar. People don't understand what the webinar is. It's actually a great way to get some access to healthcare that you're just not going to get any other way. You actually get the lab tests yourself at a local lab, a Quest lab near you, for the inflammation panel and the OGTT and the insulin survey. These are things, inflammation and prediabetes, that your doctor just does not know about. And here's the thing. Harvard Health and many others have said, look, sudden death is not always so sudden. The Hollywood picture that it's a bolt out of the blue is not realistic. It's more like real lightning, preceded by clouds, wind, and rain. Stop that metabolic storm before the lightning strikes. And here's where that metabolic storm comes from. It's inflammation, and it has to do usually with prediabetes. So again, we actually get labs, we go over them in the webinar, and then you can start finding out how you can prevent that heart attack others said that you couldn't even predict. We can show you how. Thanks.